Hi, my name is Grace, and I will be covering Chapter 7 of Phantoms in the Brain and the topic of treatment for anosognosia. So it can be very difficult to treat a patient with anosognosia because they're unaware of their condition, whether it be a physical disability or mental disorder, and it can be really dangerous if left untreated. First of all, patients with physical disabilities could really injure themselves. They're often at a higher risk for falling. Um, due to their physical disability if they try to stand up. And lack of insight in anosognosia can also be really dangerous for patients with schizophrenia or bipolar with not wanting to receive therapy or take medications because they're unaware of their disorder. So the most common treatment for anosognosia, in particular with physical disabilities, is caloric vestibular stimulation. And motivational enhancement therapy has also been found very helpful as a counseling approach for patients with mental disorders such as bipolar or schizophrenia. It helps them to resolve their ambivalence about engaging in treatment. So this presentation will mostly focus on vestibular stimulation and the physical disabilities with anosognosia. So it's important to understand what part of the brain needs to be treated. Anosognosia often appears when there's damage to the right parietal lobe, but can also occur with damage to temporal, parietal, thalamic, or basal ganglia areas. So it's really common in patients with a right hemisphere stroke to become paralyzed in the left side of their body, and anosognosia occurs pretty often with that. The exact cause of anosognosia is unknown, but it is likely due to dearrangement of anatomical or functional motoring units that mediate conscious awareness of deficits. So it's interesting, although Ramachandran's book is from, I think, 98, there hasn't been a ton of research as to why vestibular stimulation works or what exactly causes anosognosia that I've found, but it's really interesting that some of the same techniques are really still used that Ramachandran partook in. So vestibular stimulation is very effective at treating anosognosia. So what happens is they get a vial of ice water, usually about 20 cubic centimeters, which is less than 1 fluid ounce. And they shoot it into your ear for a minute, and it triggers nystagmus. So the cold water running through your vestibular system causes your eyes to rapidly move back and forth, such as in REM sleep. So prior to this happening, patients are asked about their condition to gauge their level of awareness, and then similar questions are asked after the treatment. And what usually happens is the patients after the treatment, while they're in that nystagmus still, are able to accurately report to their condition and their disability, but often the effects of it will disappear once the nystagmus ends. So that was something I found really interesting, and a lot of doctors and researchers are still unsure why that vestibular stimulation, the effect of it really varies from patient to patient. In Ramachandran's book, he found similar things of some patients, it really had no effect. Some patients temporarily, they were able to report to their disability, but usually by the next day, they forgot that they ever even testified to having a disability and are still in denial or have anosognosia about it. And then other patients, it can actually be a really helpful long-term treatment, and they're able to develop further awareness of their disability or disorder. So why vestibular stimulation works is still something that's widely speculated. I found a 2017 study that suggests what makes it effective, in particular for stroke patients who've suffered damage to the right parietal lobe, is the stimulation of underactive right hemisphere circuits by vestibular nuclei projections connecting contralaterally. So what that means is activation to the vestibular area on the left side is processed in the right hemisphere of the brain. So whenever that left side is activated, the left vestibular system is activated, it also activates the right hemisphere of the brain. One way that Ramachandran put it in the book is activation of these circuits in the right hemisphere makes the patient pay attention to the left side and notice that her left arm is lying lifeless. She then recognizes for the first time that she is paralyzed. So Ramachandran's speculation was that actually that nystagmus occurs is similar to REM sleep, and this is his explanation. He says, vestibular stimulation caused by cold water partially activates the same circuitry that generates REM sleep. This allows the patient to uncover unpleasant, disturbing facts about herself. So I couldn't find any other research of people speculating that the REM sleep network is actually the same thing that's activated with vestibular stimulation. But I found it very interesting. There's a counseling approach called EMDR, which is eye movement desensitization reprocessing. So what happens is they use a light beam with light moving back and forth to get the patient's eyes moving back and forth to trigger that same nystagmus. And it's usually in patients with PTSD, and they begin to ask them about their traumatic history and events. And normally what would be really emotionally triggering for the patient due to that nystagmus effect, they're actually able to like bring up a lot of these memories that would be very unpleasant or disturbing in a way that feels safe. I think it's a like grounding technique used that helps the brain be calm. And I couldn't find much information as to why that works anatomically in the brain, but I just thought it was so fascinating that there is other research about nystagmus and kind of that REM sleep circuitry that helps patients to uncover these disturbing facts about themselves. So that was a bit about treatment for anosognosia and vestibular stimulation and why it can be helpful as treatment. Thank you.